tonight, to start us off, a couple of vascular surgeons, Dr. Junior Univers and Dr. Mark Iltis. And, you know, I started, Dr. Univers, that you're like a plumber. Kind of tell me what a vascular surgeon does.
Very much so. Vascular surgeons, we mainly deal with blood vessels within the human body. Now, we say that we deal with any blood vessel in the human body outside of the brain and heart. So we deal with the veins, the arteries, and we even deal with another system that few folks know about, the lymphatic system as well.
So you got a blockage, needs fixing?
Absolutely. You know, we have multiple ways of fixing it. So vascular surgeons, we're the one specialty that really can attack it from all sides. You'll hear folks talk about medical management. We'll tell you the right medications to start to help prevent some of these from worsening. We can also go inside of the blood vessel, sometimes referred to as endovascular treatment, to actually fix it with stents and balloons. And then if all that fails, then we can obviously do what we call open procedures, kind of like plumbing, going in, bypassing it, replacing some of the tubings that may be clogged.
Describe a stent procedure for us.
So a stent procedure, really what we do is, if let's say you have a blockage somewhere in your leg that's causing you pain when you're walking, well, we have means of either going through your foot, through your groin, where we actually go in with a wire, and then using a stent, which is a scaffolding of metal, we can expand that stent to open that area that's blocked, so then that way you can get adequate perfusion to the limb.
Now, do you have to take some medicine after that when you have a stent?
Absolutely. There's certain medications for folks who have peripheral arterial occlusive disease that we like them to be on. If they can tolerate it, a baby aspirin. A lot of times we'll put them on another medication called clopidogrel, better known as Plavix to some. And then obviously if you have high cholesterol or prone to peripheral arterial occlusive disease, we'll put you on a medication called a statin, which just helps lowers and keeps that at bay.
All right, now you unclog them, but Dr. Iltis, there is also a procedure, geniculate artery embolization. Am I saying that right?
Yes, sir.
What does that mean, and what's it used for?
Thanks for having me, Jeff. Well, it's a very exciting new procedure we're doing. It's non-surgical. It's a minimally invasive procedure that's done in our office-based lab with numbing medication and a little IV sedative to keep the patient comfortable. We use, after we puncture the needle and get access into the artery, we use a catheter about the size of a piece of spaghetti, and I use a wire to direct that catheter behind the knee, and I take a picture called an angiogram, which is a combination of x-ray with dye, and that maps out the arteries of the knee. And that'll show me the targeted area of inflammation of the knee that's causing the patient repetitive pain from osteoarthritis. And we actually take out that small artery and the capillaries associated with it with small beads about a little bit smaller than a grain of sand. And that helps block the inflammation directly and helps eliminate the source of the pain. It's a newer procedure. It's having very promising results. And patients are having upwards of 2 to 4 years of significant pain reduction.
May avoid or put off a knee replacement, and it's an outpatient. You're home the next day walking around?
Yes, you're in the office for 1 to 2 hours after the procedure, laying flat where the area of puncture recovers. And then after that, the patients are able to walk and ambulate, usually about a week or so after they notice a significant reduction in their pain.
Great. Now, just briefly, you do some other things as a vascular surgeon too.
Absolutely. So vascular surgeon, like I said, we do the entire gamut, whether it's blood vessels in your abdomen, your chest, your neck, any of those that are blocked, we can repair, fix those. We obviously work on blood vessels to the lower leg, so when you're walking and you're having pain, we can go and reopen some of those blood vessels up. We work on the veins. Sometimes people have bad varicose veins or bulgy spider veins. We can help fix those as well for you. We do aneurysms, so when you hear of big blood vessels dilating out, we're the same folks that would go in to fix those as well. Endovascularly, meaning going inside of the blood vessel to fix it with wires and balloons and stents, or if need be, the old traditional method of open procedures where we go and cut that aneurysm out and replace it with new tubing.
Now, Dr. Iltis, there's also screening methods to do that people ought to be screened to see that they don't have an aneurysm.
Yes, sir. Mainly there are patients that are over 65, and anybody who's had a history of smoking that's over that age will get a screening abdominal ultrasound. And from there, that kind of tells us from the get-go whether or not you have an enlarged artery that we have to monitor, and that would be over 3 centimeters. And we monitor that yearly, and if it ever becomes the size of about 5 centimeters, we decrease that interval, and we may even do a CT scan at that point to get a better idea of the anatomy. If it's about 5 or 5.5 centimeters, then it's indicated to treat.
That's great information. Thank you guys for coming in. We appreciate it.
Hey,
Thank you so much.
And if you guys have artery disease, Fayette Surgical Associates vascular surgeons can help. We'll be right back.